favorites, of course. Dr. Zach Levine from the MUHC at the ER, of course, is back, and we're talking. You always inform us. You always keep us informed on so many things.
That's right.
It's such a pleasure. By the way, if you're looking for a doctor, this may be your only chance to see one here on BT Montreal. We're talking about Mother's Day, of course, and we're talking about how to keep moms healthy and really talking about issues specific to women's health, mother's health, because there are certain sets of health issues that come into play when you're a mother, not just because you are a mother, but because also you're presumably a little older in life as well, right? You're not, that's not the teenage issues you're facing.
Typically
so
not, yeah.
Let's go through a list of things. First of all, your cancer.
Cancer,
Right.
so there's good news with cancer,
Okay.
right? If you have kids, if you have more kids, if you have kids earlier, you decrease your risk of breast cancer.
Okay.
And in addition to that, ovarian and endometrial cancer, uterine cancer, your risk is decreased by having kids. So
Really?
So there is good news in the cancer department.
You know, the husbands are turning to their wives right now and saying, I want another one. Okay, but seriously, there is a risk. There is the risk is reduced, okay?
Yeah, it's reduced.
So ovarian and endometrial cancer. And by the way, we were just talking about this because we've had you on to discuss postpartum, which I struggled with, a lot of women struggle with.
Yeah.
May is Postpartum Awareness Month.
I didn't know
A lot of people still don't understand exactly what postpartum is. What is it, and what should we be looking out for?
So, by the way, the majority of women, we talked about this before, do suffer from the baby blues, but that's short-lived. And so that's like 75 to 80% of women, but that's only a couple of weeks. Postpartum depression is a severe mental health disorder. It's a depression, and it can last a long time. It can last over a year.
A lot of people don't know that. It can last over a year. People think,
Absolutely.
oh, baby blues, she'll be fine in a couple of weeks, right?
Absolutely.
Okay.
And people are and people can be barely functional. You know, this is a severe mental health disorder. And, you know, people need to be not only functional when they're a new mother, they need to be like hyper-functional, right? They have to get up every 3 hours and feed the baby. They have to be able to feed someone else, take care of someone else.
While remembering to take care of yourself, which
exactly.
often goes to the wayside.
Exactly.
Right.
I have, oh, sorry.
No, you go on.
I have to tell you something. One of the nurses, by the way, apparently it's Nursing Appreciation Week this week.
We love our
Sorry.
nurses.
But one of the nurses,
love the nurses, yes.
said to me this week, she said she didn't know your name. She's like, oh, and that pretty one on breakfast television that you talked to, she said, she has a baby. I don't know how she does it.
Okay, well, thank you to that nurse. I still am trying to grapple and figure it out. We have a great team here keeping me up. So I have to say thank you to them and my husband. But thank you to the nurse as well. But we have to, which brings us to the next point about motherhood. I get up in the middle of the night, right? And I just said to you, one of the key things for new moms, whether or not you have a morning show, right, is sleep. How important is sleep for mothers? I mean, it's the old joke, give her some time to herself, but it is actually physically and mentally important.
Oh, yeah, absolutely. So how important, I mean, new mothers are sleep deprived. There's just no way around it. I mean, that's just the way it is. So what everyone else has to do is do what we can to help. You know, let mom sleep when she can, and do other things, you know, bring meals, do a load of laundry for her, that sort of thing. Lack of sleep is a big issue.
What are we talking about physically? What can happen physically and mentally when we are that sleep deprived? You mentioned we have to wake up every 3 hours when you're breastfeeding. So what's going on? So,
I mean, certainly mentally, you know, your mood can easily take a dive.
My poor husband sometimes,
You can't concentrate. There's certainly an increased risk of depression and anxiety for sure. And then there's other things. Blood pressure goes up. Your general state of health goes down, you know, and so, and that's why other things, including depression and anxiety, are so,
these are all tied in, right? They're easily linked together. The more your lack of sleep, the more intense your depression can get, and vice versa, right? You also talk about infections, by the way, because as soon as the kids go to daycare, it's an incubator.
Absolutely. So they are exposed to, it's mostly viral illnesses, like colds, that sort of thing, and so you, as a result, you are exposed when they come home. So you may find yourself, when a child goes to daycare, at first, you may find yourself sick frequently.
All the time. I feel like, because my son isn't in daycare yet, but all of Catherine has kids, right? They're in school. She was telling me as soon as they get to school, forget it. So how true is that? It really is.
Oh yeah, it's definitely true, you know. And so for a little bit of time afterwards, it can be quite taxing, you know, because you feel like you're always sick. Or even worse to some extent is if your child is always sick, you know, and sometimes they can't go to daycare because they're sick. So they go back to daycare, they get sick, they have to stay home for a little while. You have to arrange babysitting if you're working. Right.
And is the goal to just Purell everything, or is that not really helping either? Because the antibacterial rate builds resistance. So what to do? Just go through it?
Well, I mean, to a certain extent, you do what you have to do. But yes, hand washing for sure. You know, you should definitely try and wash your hands as much as possible. And you can train your kids and train yourself to, you know, cough into the crook of your elbow.
This is common sense stuff, guys, but people forget to do this. And I love this. Okay, so the takeaway here is talking to the non-moms, like oftentimes the partners, right, and the friends. not just on Mother's Day, but if you can nutshell sort of things to keep in mind to help them out, what can we do?
Well, it's not, exactly. You know, it's nice to be nice to someone for one day, but it doesn't really make up for the other 365 days of the year. So, but yes, especially on Mother's Day, exactly, take care of her, you know, let her sleep, feed her, do whatever. She's taking care of everyone else. Because the truth is, and this is true also for the mothers, they have to be able to take care of other people, so they have to take care of themselves in order to properly take care of other people. And so what we have to do as non-mothers, you know, husbands, families, is pamper them a bit, especially on Mother's Day, but honestly the rest of the time too.
And this is coming from a doctor. Like, if he can give you a prescription right now, it's take care of the mom in your life on Mother's Day, or do you have anything special planned for the mother in your life?
You know, secret, but yes, I'm working on it. With the kids.
With the kids, which is really important, by the way. btmontreal.ca/blogs for all of these tips, all of the tips Dr. Zach has given us in the past, and of course his blog is right there. It's always a pleasure. Dr. Zach Levine, ER physician at the MUHC, and again, you said it was Nurse Appreciation Week.
It is, apparently,
Thank you to your wonderful nurse who gave me that compliment, and thank you to all the nurses out there.